No tool is more important than the vaccines on the immediate horizon. Today, Moderna became the second company to announce a very promising one. The company says it's 95% effective, slightly better than Pfizer's, which is at 90%. Moderna believes everyone can have access to its vaccine by April or May. And the key to its success might be the temperature at which it has to be stored. You see, Pfizer's vaccine needs to be stored at minus 100 degrees. But Moderna's version can be stored in standard freezers and refrigerators.
We believe our vaccine is going to be able to distribute it in existing infrastructure. We hope that means that the vaccine is going to be made available in a bunch of places, like local doctors' offices, that is going to be where people need it most.
And a second vaccine would certainly give Colorado more options. State and county health departments have been working on a distribution plan for months. Alan Gionet taking a closer look tonight, and he joins us with what he has found. Alan?
Well, Jim, these are small steps. Colorado will get its doses of the vaccine based upon our population. We're 1.7% of the U.S. population, so that's how much of a percentage of the vaccines we'll get. Doesn't sound like a lot, but you know, with the situation right now with vaccines, this could be the beginning of the end.
We can get you your shot in about an hour. Let's go. And I was like, yes, let's do this. I'd love to.
Jonathan Mendez was part of the Moderna trial. Doesn't know if he got a vaccine or placebo, but felt little effect.
Personally, I don't think I've noticed anything, just a little bit of pain and redness at the injection site.
Karen Miller is part of the state's team trying to figure out how to get it to people in 3 phases.
Are you thinking about all those phases right now?
You know, we're really not. I would say our focus is definitely on the first phase.
That includes healthcare workers, emergency personnel, correctional workers, and then people in nursing homes and long-term care. The vaccines will come in super cold, but can be under regular refrigeration for 5 days for the Pfizer vaccine, longer for the Moderna. But each takes 2 doses. And
we're also learning that these products will not be interchangeable.
That's one challenge. Another, delivery. Colorado is trying to see if it can send teams to help in nursing homes. Even with supplies, it could take a long time to set things up for the general public.
If I were to estimate, I would say closer to mid to late next year of 2021.
By then, treatments too may have improved. But fighting COVID is really a combination.
I think all of the efforts together is really what it's going to take, not one or the other.
So between December and April, we'll get about 670,000 doses of that vaccine. But remember, we said it takes 2 shots. There are a little over 300,000 Coloradans in that first phase, so that would use up most of that. Then we get to the next phases, which would include people who congregate, including the homeless and college students in dorms, then essential workers and people at higher risk. Try and figure out how to get vaccines to all of them before we even get to the last phase, phase 3, and the general public. In Denver, I'm Alan Gionet, covering Colorado First.